When you can't see a GP, where do you go?
So the service here ensures that people who can't see their GP, which is quite a common problem in this community, have got access to qualified GPs and nurses in the evening and weekends. It used to be open all day. Unfortunately, that service was cut back 5 years ago, but it's still an essential service in this community. What remains the case is that if you cannot see your GP, where do you go? And if they close this service, then people will have to go into St Mary's, to the minor injuries unit, or to the A&E at the General Hospital, and that is extremely difficult. A lot of buses do not run in the evenings from many parts of this side of the city, and we're living, unfortunately, in an era of austerity where thousands of people this side of the city are using food banks. So they do not have the money to run a car, they do not have money to get taxis, and that means that effectively we're cutting people off from NHS care, and that's an extremely serious problem, because if those people can't get there, then what they're going to do is call ambulances. Now those ambulances cost £300 every time they're called, so you're not going to save any money at all, but what you are going to do is cause people increased anxiety and increased health problems. So until the GP crisis is resolved, which means the recruitment of more GPs, the recruitment of more nurses, the training of those staff, then the walk-in centre has to stay open.
And in the 1940s, this country had a deficit twice what we have today. And yet we built a national health service and much more besides.
The CCG claims that most people who use the service, they have coughs and colds and they could go and see a pharmacist. What do you think about that?
Yeah, obviously people do have minor issues, and people with minor issues go and see their GPs. That's what we pay for. We pay our national insurance, so we have access to GPs, and if you have a cough, it's a cough.
2 years ago, I was very ill with what I thought was just an ordinary chest infection. I phoned my doctor and I mistakenly told her that I did not have a temperature, so therefore she didn't actually be able to say what I had. So it was the usual thing with an infection, just stay at home, take the cough medicine, etc., which I did, and I gradually got worse and worse. Finally, my son decided that my breathing was extremely shallow, and he got very concerned for me. So he and my husband decided to take me up to the walk-in centre, and the nurse there said that I had pneumonia, and therefore she called an ambulance, and I spent the night in hospital and put on antibiotics, etc. Now, I didn't want to go to my doctor because I thought I'd be wasting my time, probably wouldn't get an appointment immediately, and I feel, it might sound dramatic, but I think the walk-in centre did actually save my life. Thank you.
Yeah. This walk-in centre saves lives, and to suggest that this is just here for coughs and colds is really a scandalous assertion by the CCG.
And what's your complaint on the public consultation, the options that are on the table?
Well, the options to save the walk-in centre are not part of the consultation. It's an entirely loaded question that's being asked, and that's really disgraceful. It's not an honest consultation. The CCG for the last 6 months has withdrawn publicity for the Bitterne walk-in service from its literature. We complained about that, we challenged that, we've had inadequate answers on that. We believe that the CCG has made up its mind, but we are determined, like we were before, to keep the walk-in open. We beat them twice and we'll beat them a third time. But we need people to get active, we need to get people to get involved, and we need our local politicians, our MP Royston Smith and the local councillors, who all campaigned in the elections in May to save the walk-in service. They need to stand by their election promises, they need to back up the community, and they need to ensure they're here fighting to save the walk-in.